Okay, so this is my mechanical engineer who came in 7 weeks ago with peripheral neuropathy of unknown cause. He's not diabetic. He never had chemotherapy. He was in a lot of pain, especially standing on hard surfaces, like when he took a shower in the morning. And he was so bitter and angry and depressed and despondent over having this at the tender age of 47. So I treated him twice with acupuncture and infrared laser, and he did get better, but not enough. He was just as angry and bitter and depressed about his condition as ever. At his third appointment, I started bleeding him. Notice all those spider veins, which is quite unusual for a 47-year-old guy. Combine that with the neuropathy, and you get a clear picture of blood stasis, which requires bloodletting. The next treatment he came back, and for the first time I saw him really happy. He felt so much better. He could take a shower in the morning without pain. And since then, he's been like a different guy, happy, optimistic. And what I'd like you to notice is how I'm going to be choosing just the tiniest, most superficial venules to bleed. That really represents an evolution in the way I do bloodletting. When I first started bloodletting, I thought it was important to get a lot of blood and get the bigger veins, so I would have gone for the deeper, thicker veins. But as time went on, I discovered that's not necessary. There's actually little, if any, correlation between how much blood you get and how effective it is. And those tiny venules actually carry more blood than you might think. Notice they're bleeding pretty well for such tiny little venules. But what's really nice about bleeding those tiny venules is you're causing the barest minimum of trauma. I call it minimally invasive bloodletting. You don't have to go deep with the needle, barely a millimeter, and that means no pain or discomfort during or after bleeding. And also, those tiny venules don't bruise at all. If I were to bleed those deeper, thicker veins, I would probably get some bruising. And that's okay, no big deal. It's just a bruise, it'll go away. But in the meantime, it looks a little bad, and it can cause some temporary discomfort. But if I just stick to bleeding those tiny venules, he'll never feel it, he'll never see anything. And the relief he gets from bleeding those tiny venules is just as dramatic. So it's a really elegant way of treating. It's zero pain or trauma or bruising, but at the same time dramatic pain relief, and you can't ask for more than that. And that's really the message I want to get across, that bloodletting doesn't have to be this brutal, scary procedure. It can be done extremely gently and painlessly, and it's just as effective, and more effective really, because there's no barrier to doing it.